Is shoulder pain stopping you from doing simple things like reaching overhead, getting dressed, or even sleeping comfortably? If so, then this video is for you. Hello, my name is Dr. Beth Templin, and I'm the CEO and founder of HouseFit. Today, we're talking about shoulder pain, why it becomes more common as we age, what's really causing it, and what you can do to restore strength and movement without jumping straight to injections or surgery. Because for far too long, people have been told, just rest it, take something for the pain, get injections, or even eventually, you're gonna need surgery. But as a specialist in geriatric physical therapy, I can tell you that's not the full picture. Shoulder issues become incredibly common as we age, and there's a reason for that. The shoulder is actually one of the most unstable joints in the body, unlike the hip or the knee, which have deep joint support. Our shoulder relies heavily on tendons, ligaments, and surrounding muscles, making it incredibly mobile, but also highly vulnerable to injury. The most common conditions we see as you age include rotator cuff injuries, shoulder arthritis, and frozen shoulders. And when these issues develop, they don't just cause pain, they start to take away your ability to function. Shoulder pain has a way of creeping into everything. Suddenly, everyday tasks feel difficult. Bathing, dressing, reaching overhead, lifting and carrying. And one of the biggest complaints I hear is I can't sleep because I can't get comfortable. Over time, people begin to avoid using their arm altogether. And when that happens, strength declines, mobility decreases, and the problem, it actually gets worse. Here's the standard approach: pain medications, cortisone injections, rest, and eventually surgery. And even sometimes traditional physical therapy doesn't always go far enough to address the root cause. So people end up feeling stuck. They might get temporary relief, but not a lasting solution. So here's what I want you to understand. Shoulder pain is often driven by inflammation, tissue damage, and weakness, not just wear and tear. And when you address those root causes, you can restore both movement and strength. This is where regenerative therapy comes in. At HouseFit, we take a more advanced and comprehensive approach. We use regenerative therapies to stimulate healing at the source. This includes EMTT, radial shockwave, and focus shockwave. These technologies work by reducing inflammation, stimulating cellular repair, improving circulation, and accelerating tissue healing. And here's what makes us unique. We are the only clinic in St. Louis to offer all three forms of regenerative therapy alongside physical therapy. This means we're not just treating the symptoms, we're rebuilding the entire system around the shoulder. Our approach is simple but powerful. Step 1, we identify the true source of the pain. We'll go ahead and perform a detailed evaluation to understand exactly what's driving your shoulder pain. Step 2, we target the tissue. We apply the appropriate regenerative therapy to reduce inflammation and stimulate your body's own natural healing. Step 3, we want to restore strength and motion. We guide you through physical therapy to rebuild stability, mobility, and confidence. Because the goal isn't just to feel better, it's to function better. And here's something many people don't realize. Studies show that up to 70% of people will experience shoulder pain at some points in their lives. And rotator cuff tears become increasingly common after the age of 50. But here's the key. Pain does not always equal permanent damage. And more importantly, function can be restored even when imaging shows significant changes. Let me tell you about one of our clients, Sandy. She was experiencing severe shoulder pain, which would get as high as an 8 out of 10. It impacted her ability to do daily tasks like reaching overhead, lifting, carrying, and getting dressed. She started out with regenerative therapy to heal the damage, decrease the inflammation, and start the healing process. She then continued on with physical therapy to strengthen the muscles, increase the motion of her shoulder. And now, she's pain-free in her daily life and has even been able to return to our weekly boxing classes, participating fully without pain. That's what this is really about. Shoulder pain is common, but it's not something that you have to accept. If you're avoiding movement, losing strength, or changing how you live because of your shoulder pain, that's the real problem. And the longer you wait, the harder it becomes to reverse. But with the right approach, you can restore movement, strength, and independence. Thank you so much for watching this video. If shoulder pain is limiting your life, call us at HouseFit to schedule a free consultation to see if regenerative therapy is right for you. Follow us for more expert guidance on staying strong, mobile, and independent as you age. And send this to someone struggling with shoulder pain. It could change their next steps. Thanks so much.